A dog's foot has 4 weight-bearing toes. The tendons which flex and extend the toes must follow their contours like a train on a railroad track. Sesamoid bones work as a cooperative, helping the flexor tendons stay on track as they navigate a tight corner on the back of the foot. These bones are genuinely tiny, only about half the size of a pea. Each toe has 2 sesamoid bones, so each foot has 8. Sesamoid bone problems are very breed specific, and one of the predisposed breeds is the greyhound. From time to time we'll see a racing greyhound with a fractured sesamoid bone. In these dogs we've a good idea why the injury happens. Sprinting in tight circles puts enormous pressure on the outside feet. As greyhounds race anti-clockwise, fractured sesamoids affect the right feet, so it's a traumatic injury affecting the right feet of professional athletes. Most dogs with abnormal sesamoids aren't pro athletes. Most are pet dogs with no racing pedigree. Now in greyhounds we know the cause, but in other breeds we don't. What we do know is that Rottweilers are the most affected breed, with Labradors coming a distant second. We know which feet are affected, the front feet, and we know which bones are affected, the ones on the outside toes. If a sesamoid bone splits into 2 fragments, it's called a bipartite sesamoid. This condition develops very early in life and it rarely causes pain. If a sesamoid crumbles into multiple pieces, it's called a fragmented sesamoid bone. This condition is especially common in Rottweilers. Once again, fragmented sesamoids, like bipartite sesamoids, are often non-painful. To illustrate the point, one study identified fragmented sesamoids in 7 out of 10 Rottweilers, but only 2 out of 10 develop long-term lameness. Another study of 50 clinically normal adult Rottweilers found 4 out of 10 had non-painful fragmented sesamoid bones. We have plenty of evidence that sesamoid bone changes are common, but sesamoid pain is uncommon. So before we treat an abnormal sesamoid, we need to be sure that it's the true culprit. We do this by ruling out more common causes of lameness. This is especially important for Rottweilers and Labradors because they're ranked number 1 and number 2 for elbow dysplasia. The best way to rule out this common condition is with a CT scan. After that, the fastest way to relieve sesamoid pain is with a joint injection. We inject anti-inflammatory medications into the toe joint next to the abnormal bone. If the fragmented sesamoid was the true culprit, we'll see rapid improvement, usually within 3 to 4 days. What about surgical fragment removal? Well, to date, published studies haven't managed to prove a benefit. But this is just what we'd expect. Sesamoids play an important role, so your dog's foot misses them when they're gone. This is why specialist surgeons like me do our best to spare the sesamoid bones. We save surgical removal for those rare patients who suffer persistent pain despite high-quality medical management.